A very good afternoon. I am Professor Ruckmani from Department of Pharmaceutical Technology, Anna University, BIT campus, Tiruchirappalli, Tamil Nadu. I am undergoing a lead program at Aligarh Muslim University. As a part of the program, we are developing the lecture contents for the MOOC. So today I am going to talk about the role of nano carriers in drug delivery system. As in the department, we have been working in the field of drug delivery systems for the past 25 years. We have experimented many carriers and how their role and how it effectively improves the delivery system as well as effective release and viability of the drugs. So in the whole thing, I will have in my second slide, these contents are introduction to drug delivery, need of novel drug delivery systems, role of nano carriers and characteristics of nano carriers and types of delivery systems, solid lipid nanoparticles, micro nano emulsion, SMEDS, that is self-emulsifying drug delivery system, self-micro emulsifying drug delivery system, and a summary will be given the last. So coming to the drug delivery systems. So what is the purpose of giving the drug? You know, drug means it is a substance derived from natural, semi-synthetic or synthetic sources, and it has been used for the purpose of diagnosis or treatment of the disease. But the drugs cannot be given as such because some of the drugs may be bitter in taste and some may not be soluble in J fluids, or some may not be bioavailable also, or some may get degraded during the course of a transit from the one region to the another region within the body. So in such cases, you need to use some of the carriers so that the drug delivery will be beneficial one. So if you take the definition of the drug delivery, the appropriate administration of the drugs through various routes in the body for the purpose of improving the health. And the drug delivery as such, this is a field, a highly interdisciplinary field, and in this case, it has to be very important to take care of the physicochemical properties of the drugs and what is the body effects to the drugs and how the drug gets interacted with the body, and among the drug and the excipient what kind of the interaction takes place and how the drug effect is being improved and how the patient complaints will be achieved. So if we see drug delivery, in a broad sense it can be divided into two parts. One is the conventional delivery systems, other is the controlled delivery system. In case of the conventional delivery system, whatever available delivery systems, for example enteral or parenteral or other like external applications, there are conventional delivery systems, but they may not be very efficient in delivering the system as per the requirements of the patient. But in case of the controlled delivery system, it is very well possible. So the under controlled delivery system, there are many different types of the delivery systems are there. Either it may be a sustained delivery systems or extended delivery system or site-specific delivery system or pulsated delivery system. So in this slide, it gives the plasma concentration versus time profile of the drug upon oral administration. Upon oral administration, the drug concentration increases and reaches the maximum. You know, when the drug reaches at a minimum effective concentration, the onset of action or the pharmacological response starts. So, as long as the drug concentration is above the MEC, the therapeutic response or the pharmacological property will be there. So, the period from which the MEC to period up to which it is being maintained is called as the duration of the action. But most of the drugs, the concentration of the drug in the plasma goes beyond the maximum level. At that cause, it causes the toxicity, or under the minimum effective concentration, there is no therapeutic effect. So, but what is expected? So, with the successful therapy expects that the drug concentration should be within the therapeutic window. So, once it crosses the therapeutic window, there will be a toxicity or side effects appears. So, what we are trying to do through the drug delivery approach, the drug should be released, the drug concentration should be within the therapeutic window so that the side effects will be either eliminated or will be reduced. So another very important problem with the drugs delivery is most of the drugs are either weakly acidic or weakly basic in nature. So that many of the drugs have the poor solubility in water, and this poor solubility is a major challenge in the drug delivery. And 90% of the active ingredients have the low aqueous solubility. So the drug solubilization is the very important criteria There are already existing mechanisms are there, but each has its own advantages and the disadvantages. So out of all, the nanotechnology gives a excellent remedy or solution to the solubility of the drug. So through nanotechnology, since the size reduction and increasing the surface area, it improves the solubility of the drug, it improves the viability of the drug and reduces the toxicity and enhances the release and provides a better formulation opportunities for all the drugs. By making the drug into the minimum size range or nano sizing, you are increasing the surface area and there is a resistance to settling, enhanced solubility and increased rate of dissolution and increased oral viability. So whatever the exact is, because of the increased solubility, increased viability, less amount of the dose can be given and because of this less dose, reduced side effects are there and ultimately patient compliance is very much possible. And in the case of the nano delivery systems, so it has a very big role in the different kind of the treatment of the major chronic diseases like cancer and all. So in cancer nanotechnology, one day dose formulation is very much possible. So already available taxol delivery and improved ophthalmic delivery of the formulation using hydrogels of nanoparticles and oral insulin formulation and amphotericin B formulation is using liposomes. And what are the opportunities and challenges? So it's very important that the main goal is to improve the stability of the active pharmaceutical ingredients in the biological environment to mediate the biodistribution of the active drugs, improve the drug loading, targeting, transport, release and interaction with the biological barriers. So many drugs, for example, especially for the case of the very sensitive drugs, controlled release formulation is very much possible. And all the carriers, whatever the material you are going to use for the nanoparticles, they must be biocompatible in and biodegradable in nature. And you can go for the different kind of the functional delivery systems like active drug targeting or on-command delivery, intelligent drug release or self-regulated delivery systems. Even the carriers could be the viruses also. So here this aim of the any nano carriers is like if you have any nano carrier, the aim of the nano carrier delivery system is to minimize the drug degradation and inactivation upon administration and to prevent the undesirable side effects because you are trying to maintain the drug concentration within the therapeutic window, increase the drug viability by improving the solubility of the drugs and fraction of the drugs. So it is whatever the expected, very importantly, right amount of the drug concentration will be at the right place. And if you see the what would be the properties of the nano carriers, it to prolong the circulation in the blood, ability to specifically recognize and bind target tissues, ability to respond to local stimuli characteristics of the pathological site, ability to penetrate inside the cells bypassing the lysosomal degradation for efficient targeting because especially when the drug goes into the blood plasma, there were obsonizations are possible. So this can be minimized. And here this slide gives the complete advantages of pharmaceutical drug carriers. As I said earlier, it should be biodegradable in nature, easy and reasonably cheap, to have small particle size and to possess high loading capacity and to demonstrate prolonged circulation and to specifically and non-specifically accumulate in the required sites in the body. And some of the carriers you can play around, you can functionalize the nano carriers so that when there is a change in the environmental pH, the drug could be released. It is very well suitable for the cancer drug delivery system. And if there is any chemical stimuli or if you apply any external application, that is application of rapidly accelerating magnetic field or application of external fields. So it's kind of a stimuli responsive delivery systems is possible with the case of the nanoparticular delivery systems. So coming to the, so far we have discussed the what are the delivery systems, what is the conventional delivery systems and the control list delivery system and what are the advantages and disadvantages or the opportunities available with the delivery systems and how they solve. So now we will see the different types of the nanoparticle or the different delivery carrier systems. One is the solid lipid nanoparticle as drug carriers. So whatever the drug concentration there is because of poor absorption, rapid metabolism, elimination that can be very well can be overcome by the nano-sized carriers and poor drug solubility can be also be increased. And And whatever the advantages with the nano delivery system, the solid lipid nanoparticles also have. In addition to this, that we have since our body has the indigenous lipid system. When you prepare a lipid-based delivery systems, there will be compatibility will be there. And this slide gives the commercially available nano lipid carrier systems. So you can see that vitamin E, tocotrienol, retinol, all these things are given as the nano lipid carrier system. And if we see what are the ingredients in the solid lipid nanoparticles, there are general ingredients, solid lipids, emulsifiers and water. And this slide gives the what are the list of materials that can be used as sender lipids or emulsifiers. And you know pretty well when the physical chemical properties of the drug and the carrier play a role. Same thing, the preparation of the solid lipid nanoparticles or the carrier delivery system is also important. So in case of the SLN preparation, there are listed methods of preparations of the SLN and you can choose according to your requirement what is the drug and the thing. And in case of the characterization of the lipid nanoparticles, microscopy and spectroscopic method characterization is important. In case of microscopy, the topographical measures should be taken care of. So there you can use the scanning electron microscope and TEM images and also cryo-TEM, and it can be characterized by different like FTIR, DSE and zeta potential. And there are problems in the SLN preparation because when you use different method, every method has its own advantages in it. So it's you have to choose which. Suppose if the drugs are very highly sensitive to the high pressure, then high pressure homogenases can be used. And you can use different kind of the routes for the administration of the SLN preparation. Next comes the microemulsions. Microemulsions are nothing but they are the thermodynamically stable systems and they are composed of water and oil and amphiphil. And they are the stability and unique solubilization properties. So if you use microemulsion and emulsions, emulsions are thermodynamically unstable whereas microemulsions are thermodynamically stable. And they are highly dynamic system and interface may be highly curved and you have the high surface area. So compared to the conventional emulsions, microemulsions are much better. And if you compare microemulsions and nanoemulsions has certain characteristics, better advantages than the microemulsion because these nanoemulsions come in between the microemulsion and the traditional emulsions. And the particle size range may be 300 to 300 nanometer. And because of the Brownian emulsion prevents creaming, nanoemulsions often have the long-term good stability and nanoemulsions are kinetically stable in nature and they are easy to produce things. And this slide gives the structure of the microemulsions and the nanoemulsion. Why microemulsions? Because they have the ability to protect the labile drugs, control least possible, increase the solubility and availability, reduce the patient variability, possible to prepare different formulations suitable for different routes of administration and easy of preparation. But there are certain drawbacks are also with the microemulsion. Large concentration of surfactant and co-surfactant necessary for stabilizing the microparticle and limited solubilizing capacity for high melting substances. Because high melting substances you have to go for the high melting temperature, then it will produce limited solubilizing capacity. Surfactant must be non-toxic for using pharmaceutical applications. And these are the characterization of the microemulsions. And this slide gives the commercially available lipid-based formulation having the enhanced bioavailability. And next comes the self-microemulsifying drug delivery systems. So here you are using the mixture of drug, oil and surfactant and or the co-solvent which can form a very fine oil in water or water in oil emulsion. And upon dilution, you can use it for the oral administration. So these self-emulsifying drug delivery systems are either anhydrous or low in water content, so which can be used for allowing the encapsulation of unit drug substance. And whatever the material you are using, they are mainly useful for the oral ingestion. And emulsification, which occurs with little or no input of energy. So it is self-emulsifying delivery systems. And these formulations avoid the dissolution step of the lipophilic drug and very high surface area to volume area and faster drug release from microemulsion in a reproducible manner. And key formulation issues in the case of the self-emulsifying delivery system, the very importantly, nature of the lipid should be considered, the chain length and the importance of the self-emulsifying or particle size, and relative portions of the lipid versus surfactant. And you can give the delivery system oral drug or topical or parenteral or ocular. And decide characteristics of the marketed drug. So it should be high drug solubility, low toxicity, efficacy at least equal to the marketed drug, and it should have the good stability. So if you are preparing a formulation, so whatever the formulation prepared, you should have these characteristics, and very importantly, you should have the address the unmet needs of the drugs. And these are the vehicles used for the poorly soluble drugs. So in summary, we have to exploit the role of nano carriers in the delivery system very importantly, because already in the market there are nano based delivery systems around. So but how effectively that can be used with available nano carrier, and whatever the carriers you are choosing, that should be biodegradable and bioavailable. And very importantly, when you go to the nano level, the safety of the formulation need to be ascertained at all angles. Thank you very much for your patient hearing. And if you have any questions, I'm eager to answer. Thank you.